Modified bed bath on a dependent resident. Knock, knock. Hello, Mr. Jones. My name is Lisa. I'm going to be your CNA today, and I came to help you get cleaned up. I'm going to go wash my hands and gather some supplies, and then we'll get started. So I'm going to wash my hands. I'm definitely going to need gloves for this procedure. I'm going to gather my supplies, which I have here. I'm going to set these down on a clean surface. Okay, and I'm actually going to move your water pitcher for just a minute, and I'm going to draw the curtain for privacy. I'm going to go ahead and raise this rail. I'm going to raise this rail up here, Mr. Jones. Okay, and I'm going to raise your bed up so that I can reach you a little better. So I'm going to raise the bed to about waist high, just so that I can use proper body mechanics. And I'm going to drop this rail so I don't have to work over it. Okay. My gloves. All right, I want to start with the bath blanket. I'm going to drape him with it. Keep him covered and for privacy and for warmth. Okay, Mr. Jones, I'm going to go ahead and cover you with the bath blanket here. I do not want to shake the linens. Just want to pull them apart. Okay, can you hold on to this for me, like up to your chin, like this? Okay, he can't, so I'm going to tuck it behind his shoulders, and I'm going to peel down his top covers, because I don't want to get those wet. Okay, keeping him covered. All right. Now, Mr. Jones, do you need to use the bedpan or the urinal before we get started on your bath? Okay, he said no, but I do want to offer for him to use the restroom or the bathroom first, bedpan or urinal. Okay, so I've got 2 basins, warm water in each one. I'm going to test it with the bath thermometer. I do not want my water temperature to be over 105 degrees, so I'm going to test that. Mr. Jones, would you like to test this? Make sure that it feels okay to you. Okay? And I have one more here I'd like for you to test. Okay, good. All right. So I'm going to assist you in removing your gown, okay? So I'm going to untie back here. And I want to keep him covered while I'm doing this. Now, Mr. Jones has an affected side. His right side is weaker than his left side. So when I am undressing him, I want to undress the strong side first. Okay, so I'm going to have you pull your arm out of the sleeve here. Okay, very good. That way I have all the slack to work with over here to undress his weaker side or affected side. All right, so I'm going to help you with that side. All right, very good. Okay, now I also want to bring a bag with me for the dirty linens, and I set it over there. I'm going to set his gown down at the foot of the bed for just a moment and grab my bag here for my dirty linens. So I'm going to go ahead and just place it at the foot of the bed, like so. Okay. I want to be sure to only uncover the part that I'm working with or washing. Okay, I don't want to expose him unnecessarily. All right. I'm going to go ahead and apply my gloves. I've got some soap and some deodorant. One of my basins here is going to be soapy water. One is for rinsing. Okay, I'm going to start with just plain water because I don't want to use soap on his face. Okay. All right, so I'm going to start with his face, and I'm going to start with your eye here, okay, your right eye. I'm going to start at the inner canthus and wipe down and away, okay. Get a new part of my washcloth if I needed to wipe again or to move to the next eye. Okay, very good. And then I'm going to wash his face. I'm going to kind of start in the midline and wash away. I do want to wash the far side first. So I'm going to wash that side. And then I'm going to wash this side. And then I'm going to kind of get behind his ears and wipe down his neck. Okay. And then I'm going to pat his face dry. Okay. Now I'm going to work my way to this arm here. Can you raise your left arm up for me? I'm going to place a towel under his arm so that I keep his sheets wet, and I'm only going to uncover his arm. Okay, so soapy water this time, soapy washcloth. I really ought to make a bath mitt. Okay, I'm going to hold him at the wrist here in long strokes. I'm going to wipe his arm, wash his arm. I do want to check the bony prominences for any skin breakdown. Bathing is the best time to check for skin breakdown. I'm going to get underneath your arm here, soapy water, okay? After the underarm, I'm going to toss this washcloth into my dirty linen bag. And then I'm going to rinse this arm, rinse the underarm, and I'm going to go ahead and toss that off the underarm. And then I'm going to pat dry. You doing okay, Mr. Jones? We're almost done. There's the arm here. Soapy water. And I'm going to wash his hand. Okay, after the hand, I'm going to toss it. And with my other washcloth here, I'm going to rinse. And then pat dry, pat the hand dry. Okay. I'll have you raise your arm up for me. I'm going to remove this towel. And would you like some deodorant, Mr. Jones? He said yes, so I'm going to go ahead and apply some deodorant under his arm. I'm going to cover that arm up for a minute, and I'm going to assist him to get dressed. So for a modified bed bath, you start with the face, wash the face, one arm, underarm, and then hand last. Now, if his care plan said to assist him with washing his hair, I would also do that. Now, his right side is affected, so I'm going to dress that side first when I assist him to get dressed. That way I have all this slack to work with. Okay, put your hand in there for me. Okay, go ahead and tie this gown here. Go ahead and take off my gloves. And I'm going to place this in a chair. I'm going to cover Mr. Jones back up. and remove the bath blanket without exposing him. Okay. Are you comfortable, Mr. Jones? Is there anything else I can get for you? All right, let me go ahead and lower your bed back down, lower your rails for safety. Thank you for letting me help you today. And I would also clean up all supplies and store those where he keeps them in his room. Table. Alright, here's your call light. Is this okay over here? Alright, be sure and push your button if you need anything. Okay, I'm going to remove the privacy curtain. And I'm going to wash my hands before I leave the room. And thank you again, Mr. Jones, for letting me help you. I'm going to go document that he had his bath, and any skin breakdown, anything like that, I would report immediately.